Good afternoon, and welcome to today's interview on a very important health topic, cholesterol, a silent killer, and the importance of early detection among the Indian youth. My name is Nisha, and today with us we have Dr. Abhijit Vaidya, practicing cardiologist, founder director of Sanjeevani Cardiac Care Center, Pune. Dr. Manoj Bisai, consultant cardiologist, practicing at Sayadri Hospital, Pune, and Dr. Anil Gowli, Director, Founder, Consultant Cardiologist at Ganpati Super Speciality Hospital, Aurangabad. Thank you so much, Doctor, for being here with us. Today, we'll be discussing about cholesterol. What is it, the risks associated with high cholesterol, and why is it crucial for the Indian youth to have an early detection? Thank you, doctors, for joining us. Let's start by addressing the key concern. Why should young Indians be concerned about cholesterol?
See, the most important thing is that the incidence of heart disease is rising very fast in our country. And most of the heart disease is because of the atherosclerotic cardiovascular disease. And the most important contributing factor to that disease is high LDL level. Another very important point is that we are finding younger and younger people falling prey to this very deadly disease. See, actually 25% of the deaths in our country are because of heart disease. Most of the heart disease is because of atherosclerosis, and the most important contributing factor is high LDL. And now we are having more and more younger people who are suffering from heart disease, and very unfortunately they are dying because of the heart attacks. And LDL is the most important and another important point is that it's a modifiable cardiac risk factor. So the two most important modifiable cardiac risk factors, one is smoking and high LDL. So the young people must have to become aware about the importance of high LDL.
Yes, thank you so much, Doctor. Dr. Manoj, if you could tell us what are the key factors that are contributing to the rise of cholesterol among the young Indian youth?
So the youth in India particularly, there are many factors which lead to increased cholesterol level in the young age. The first one is dietary problems, that they have very high food intake of cholesterol, full cream milk, oil and junk fast food, which is very popular among the youth today. The second is a genetic predisposition, that they may have a familial dyslipidemia, homozygous or heterozygous, and then the sedentary lifestyle, that the younger people are not exercising enough.
Yes, thank you, Doctor. Dr. Anil, could you tell us what are the risks associated with high cholesterol among younger people, and how does it affect them in the long run? How does it affect their health?
Already both of my colleagues told that this deadly disease, heart attack, is very much rising concern in India. And one of the modifiable risk factor in this myocardial infarction or any other vascular event is high cholesterol, what we call as bad cholesterol.
Yes.
When this bad cholesterol is not treated and it goes persistently rise in the blood vessels, it goes and accumulates inside your blood vessels and narrows your blood vessels, which leads to the decrease in the blood supply to the vital organs inside our body, which leads to the bad outcome, or it may lead to the myocardial infarction or brain stroke or any other organ damage.
Yeah. Doctor, what do you think can be done to help the young adults understand their cholesterol levels?
It's a very simple thing that they have to check their blood levels of cholesterol. Now, how early one should check it is a question. Now, today, I always say that the first checking of lipid profile, it can be random, it can be non-fasting, not necessarily has to be 12 hours or 14 hours of fasting at the age of 18. Now, if there are no risk factors, there is no family history, then you can check it every 5 yearly. And if there is a strong family history of heart disease, or if there are any risk factors like type 2 diabetes mellitus, sedentary lifestyle, obesity, high BP, any risk factor, or even smoking and tobacco consumption, then definitely you have to check it more frequently. I would say every 2 yearly. And if you find any lipid abnormality, then it can be at least every yearly. So another thing, know your numbers.
Yeah.
They must know how high LDL is bad for your heart. So for general population, LDL has to be below 100. And now with the risk factors or with appearance of heart disease, it has to be below 70 or it has to be below 55. So know the numbers.
Yes.
That is a very important thing. And check your blood lipid levels.
Yes, thank you, Doctor. Dr. Manoj, could you tell us why is early detection and investigation of cholesterol so important?
Early detection is important because the patient will know what his cholesterol level is, and then he can take an informed decision regarding his lifestyle to reduce his or make his dietary pattern better, to exercise regularly. And by doing this and keeping his LDL well within levels, he can reduce the risk of cardiovascular events, myocardial infarctions, strokes or paralysis, and peripheral artery disease.
Yes. Doctor, could you tell us what exactly is CIDIL level? Could you elaborate it for us?
Yeah, basically in this today's fast moving world, there is score for estimate risk of everything, like CIBIL score. When you go in bank and apply for loan, they will check CIBIL score. So just there is to check cardiac health, people are now moving to the cholesterol investigation for day, and that is in short called as CIDIL score.
Yes.
And it is very easy to remember and looks much more attractive.
Yeah. Yes. Thank you, Doctor. Doctor, could you tell us how can we get a cholesterol investigation done, and also how can we get a CIDIL level done?
See, it's very simple. Check your lipid profile. And as I've said that in the past, we are stuck up with the idea of a fasting lipid profile. That was tedious and it was not very practical. Now, the Lipid Association of India has very clearly said that a